We're now live. You can go ahead.
Good afternoon. Thank you for joining us today. I'm Paul Gullickson, Communications Manager for Sonoma County, and this is our COVID-19 update for Wednesday, October 20th. Let's begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Paul Gullickson.
Thank you, Gilbert. So here in Sonoma County, we are inching ever closer to reaching that 80% of our eligible population being fully vaccinated, a key milestone in our effort to control the spread of this virus and to protect our community from the pandemic, which has now been with us for 20 months or so. We are currently at 78% of our eligible population being fully vaccinated, with another 7% partially vaccinated. And here in Sonoma County, we are grateful that we have seen our COVID cases fall considerably since August, and our hospitalizations have been cut in half in just the past few weeks. The other good news is that we expect the number of Sonoma County residents eligible to be vaccinated will grow considerably. We have roughly 37,000 children in our county who are between the ages of 5 to 11 years old. Right now, they are not eligible for the vaccine, but we believe that will change in the coming few weeks. Federal regulators will consider expanding the age range for the Pfizer vaccine later this month, and with final approval coming from the CDC expected that first week in November. So here we are already planning for pediatric vaccination campaign. As with our effort to vaccinate those 12 to 17-year-olds, we are working closely with the Sonoma County Office of Education on an outreach campaign and to set up a series of school-based clinics to give parents an option to vaccinate their children. They also will be encouraging them to go to their primary care physicians for those vaccines. We'll provide other information as well. Like everything that we have done during the pandemic, our pediatric vaccine campaign is being planned with a focus on equity. The target sites for school-based vaccine clinics are in areas with recent high case rates, areas with high number of English learners, and areas with lower vaccination rates. Our health equity team is also seeking additional engagement and input from community advocates who represent these communities. This will be a part of our discussion tonight, and we want to focus today's briefing on our equity approach to the vaccination, particularly the upcoming pediatric vaccination campaign. But first, I'd like to turn it over to Dr. Sundari Mace, our health officer here in Sonoma County, for more on the current state of the pandemic. Dr. Mace?
Great, thank you so much, Paul. Our case rate, after significantly coming down from the Delta surge over the summer, has leveled off. We are averaging 9 new cases per day per 100,000 residents and have a testing positivity rate of 2%. The good news to report is that hospitalizations continue to decrease. There are currently 19 people in Sonoma County hospitals with COVID, compared with 84 just 2 months ago. This is a sign that our vaccination campaign is working to prevent the worst outcomes of the virus. With so many people in Sonoma County vaccinated, I am feeling optimistic about the current state of the pandemic. But I temper that optimism with a note of caution as we head into the winter months, when many people will be spending more time indoors and gathering over the upcoming holidays. I want to remind everyone about my recommendations for having a safe Halloween and taking precautions while still enjoying the festivities. As you recall, last year, we discouraged door-to-door trick-or-treating because our case rate was high and climbing, and we had no vaccines to help fight COVID. Well, this year, we believe that it's safe to do outdoor trick-or-treating for Halloween and take part in outdoor Dia de los Muertos activities. But trick-or-treaters should avoid large groups and should wear a mask that covers their mouth and nose. Before eating any treats, people should wash their hands or disinfect with sanitizer. Indoor gatherings of unvaccinated people, including children, should be avoided. If you're sick or concerned that you've been exposed to the coronavirus, stay home. People greeting trick-or-treaters at the doorstep should wear masks while distributing candy. Instead of inviting children to reach into a communal candy bowl, consider handing out individually wrapped treats or placing them on a table. Do not distribute candy if you're sick or have been exposed to COVID. As more people get vaccinated, we do hope to return to a more of a sense of normalcy and start to enjoy holidays that we missed last year. But we also need to do so safely with the virus still circulating in the community. We have currently fully vaccinated about 340,000 Sonoma County residents, but many people still haven't received a single dose of protection. So we definitely have more work to do. I also want to note that influenza season is here, and it's very important for everybody to get a flu shot as well. For more on our vaccination campaign, I'll turn it over to Dr. Urmila Shende, our vaccination chief.
Thank you, Dr. Mace. Our vaccination campaign has been extremely successful so far. As Paul mentioned, we have fully vaccinated 80%, nearly 80% of the county's 12 and older population. A closer look at the demographics reveals that certain age groups are now almost completely vaccinated. Residents 70 and older, which last year experienced the worst outcomes, including a majority of our COVID deaths, are now more than 90% fully vaccinated, with another 8% partially vaccinated. These oldest members of our community have not had nearly as bad outcomes since they have been protected by the vaccine. Most age groups 70 to 80% fully vaccinated. Even the youngest age group, those 12 to 14 who only became eligible in May, are now 60% fully vaccinated. This is helpful to note as we gear up to vaccinate an even younger group. A Food and Drug Administration advisory panel is scheduled to meet October 26th to review the data that Pfizer submitted on vaccinating 5 to 11-year-olds. If pediatric doses are approved by the FDA, then a Centers for Disease Control and Prevention advisory group begins meeting on November 2nd and 3rd to decide whether to recommend shots for children aged 5 to 11. In preparation for this decision, the County Department of Health Services is working with local health and education leaders to provide free vaccines to children as soon as they are authorized. Families will first be encouraged to seek vaccinations from their local medical provider, pediatrician, or family care doctor. Vaccination clinics will be created at schools to serve people without convenient or affordable access to healthcare providers. Targeting areas with high rates of recent COVID-19 infection, low vaccination rates, higher proportion of free and reduced lunch recipients, and neighborhoods with large numbers of English language learners. By December 1, we expect to vaccinate a quarter of the 37,000 children in Sonoma County aged 5 to 11. The campaign will seek to vaccinate half of these children by the end of January and 70% by the end of February. As always, we'll approach this next phase of the campaign with an equity lens, which we'll be talking about shortly. But first, I'd like to hand it over to Kate Pack, our lead epidemiologist, to present some data. Kate?
Okay, thank you, Dr. Shende. Let my slides. Okay. So just look at some of the latest COVID-19 data. As was mentioned earlier in this call, we are seeing that case rates, new cases per 100,000 residents per day, and test positivity continue to decrease. We also are seeing a decrease in our COVID-19 hospitalizations. As of today, we have 8 new cases per 100,000 residents, 12% test positivity in the overall county, and 1.8 test positivity in the lowest healthy places index quartile. And those are those areas of the county where residents have least access to resources to support their health and well-being. 19 individuals are currently hospitalized with COVID-19, and looking since July 1st, 83 individuals have passed away from COVID-19 complications. Looking at our case rate by vaccination status, we continue to see here in the orange line the case rate among the unvaccinated population, that this case rate is over 3 times that of the fully vaccinated population. So a difference between about 14 new cases per 100,000 among the unvaccinated and 4 new cases among the fully vaccinated population in our county. Looking at case rates by racial ethnic group in the past 60 days, if we just look at the number of cases that we've seen in the past 60 days, we can see that the majority of those are among white residents, Latinx residents. But if we take into account the size of these different populations in our community and look at the rate of cases per 100,000, we can see disproportionate impacts in our Pacific Islander, American Indian, Alaskan Native, Black, African American, and Latinx communities. Looking at case rate trends by city in the past 60 days, in most geographies, we are seeing a decline in case rates. The greatest number of cases observed in the past 60 days were in Santa Rosa, Petaluma, Rohnert Park, and Sonoma. And relative to population size of these cities, the greatest weekly rates of new cases per 100,000 are being observed in Sonoma, Sebastopol, and Cloverdale. Our testing remains high, but we are beginning to see a decrease along with our decreased transmission levels that we've seen in the community. There's been less demand for testing, but our testing remains high. It's currently 535 tests per 100,000 residents per day, but we have seen a decrease among all race, ethnicities, age categories, and testing has either stabilized or decreased across all geographies in our county. Looking at the most recent source of infection that we're seeing among our cases, we continue to see household transmission as the most common source of transmission, followed by gatherings, large and small, as well as workplace transmission, and this other category, which consists of other kinds of community transmission, such as infections occurring at entertainment venues and retail and other community locations. I did want to mention that we do have a new dashboard page on our COVID-19 cases dashboard that focuses on cases among students and staff in transitional kindergarten to 12th grade settings. So looking at our COVID-19 cases in schools, just since reopening this fall, we've had a total of 653 cases, with the majority of those cases among students, 586, and 67 among staff. Looking at among those cases, how many were definitively determined to be due to on-campus transmission, so person-to-person contact and transmission of COVID-19, 69 of those cases were due to on-campus transmission. And this chart is showing trends in the numbers of cases that we're seeing per week among students and staff. We did see a peak in cases during the surge that we saw in the overall community and have seen decreasing case numbers. Whoops, excuse me. You'll also be able to find on our schools dashboard page weekly case rates per 100,000 population divided, and this is among students. So this gray line is showing the overall case rate per week per 100,000. This gold line is showing the TK through 8 grades, and the blue line is high school. Excuse me, there we go. Okay, and then looking at our hospitalizations in the county, we have continued to see that unvaccinated persons are hospitalized at much higher rates as compared to those that are fully vaccinated in our community. So unvaccinated individuals, we've seen that overall, they are 7 times more frequently hospitalized than their vaccinated counterparts. And during the peak of the Delta surge, we saw this increase to a rate that was 14 times that of vaccinated residents. And looking at death rates, and this is looking at rates of death per 100,000 by age group, we can see that in the 16 to 44-year-old age group, the unvaccinated death rate is 29.5 deaths per 100,000 as compared to 0 deaths per 100,000 among vaccinated individuals. In the 65 plus age group, this difference grows to a rate of over 570 deaths per 100,000 among unvaccinated, as compared to 22 deaths per 100,000 among the vaccinated. When we look at these figures overall and adjust for age, we can see that local unvaccinated individuals are over 30 times more likely to die from COVID-19 than our vaccinated individuals. Looking at our vaccine administration, as Dr. Shende mentioned, we are nearing, for the 12 plus eligible population, nearing 80% vaccinated in our community. We're at 78% fully vaccinated currently, and 7% partially vaccinated. We continue to see increases in vaccination rates, particularly among the younger age groups. This is 12 to 15, 16 to 24, 25 to 34. And looking at the proportion vaccinated by race and ethnicity, although progress has been made, we continue to see a smaller proportion of Latinx, American Indian Alaskan Native, and multiracial residents who are fully vaccinated. And that's represented here by the blue color of bar. Looking at our vaccine equity measures, and this is again referring back to the Healthy Places Index quartile that I mentioned earlier. We can see that in the lowest quartile, where residents have least access to resources to support their health and well-being, that 26% of all doses have gone to residents in this quartile. And when we look at the vaccination status of residents living in that quartile, 81% of the residents are at least partially vaccinated, with 73% being fully vaccinated. So looking at our data, it's one conclusion that we can draw is that it's really important that vaccine is playing a very important role in terms of preventing hospitalization and death associated with COVID-19. So if individuals have not yet received their first or second dose of vaccine, they're strongly encouraged to do so, because we can see that local unvaccinated residents are 7 times more likely to be hospitalized and over 30 times more likely to die from COVID-19 than our fully vaccinated residents. And since June, we have seen a concerning increase in the number of deaths among unvaccinated individuals under the age of 45. When we look at the average age of COVID-19 death among those that are unvaccinated versus those who are fully vaccinated since June, the average age of death for unvaccinated residents is 60 as compared to 78 among fully vaccinated. For residents who are fully vaccinated, Pfizer boosters are available and recommended for adults over the age of 65 plus, adults 50 to 64 who have chronic or comorbid conditions, and younger adults with comorbid conditions such as obesity, diabetes, and heart condition that may place them at greater risk for complications from COVID-19. And I wanted to let you know that later this week, we will be adding data to our vaccine data dashboard, tracking booster dose administration. This is a snapshot of our data from this past Sunday. And one important thing to mention in interpreting this data is that the number of individuals eligible for a vaccine booster changes daily, because you need to be 6 months past completing your Pfizer vaccine series. And so each day, more residents become eligible. This is the number of residents 65 plus who were eligible as of Sunday for a booster shot. About 12,000 of those individuals had received the booster shot as of that day. And you can also see that other individuals in these other age groups have also received boosters. So we can see on this bar here, this blue color represents those 65 plus who've received their booster shot. Green is those who are eligible currently for the booster shot. This yellow is those 65 plus who have completed their vaccine series, but they aren't 6 months past their last dose yet. So not yet eligible, but will be soon. This gray bar is those who received a different type of dose, so Moderna or J&J. And we expect to hear more news soon about when these individuals will be eligible for booster, and we'll add that data tracking to our dashboard as well. And then this red color is those who have not completed any doses of any brand of vaccine or so are ineligible for a Pfizer booster shot. And that's the end of my slides, and I will stop sharing screen and turn it back to Paul.
Great, thank you, Kate. That was a lot of great information. Now I'd like to shift gears a little bit and turn to Denia Candela, our Sonoma County's Health Equity Manager, to help address our equity-based approach to the vaccine campaign for our community. Denia?
Thank you, Paul, and thank you to our public health team. It's important that we start by acknowledging really the inequities that we have witnessed throughout the pandemic and how they're not new to our county, state, or nationwide. People of color have been disproportionately underserved by our systems and institutions, which is why it's important that we focus to the best of our ability on equity-centered design processes that will then lead to healthier outcomes. As you may recall, we launched almost a year ago our equity framework that was centered in the voices of our health equity community group, formerly known as the Latinx Health Work Group. We had gaps, and now we're here with some lessons learned. The main one is ensuring that our processes are centered around those who have ears and eyes towards the communities that we're trying to reach. Most recently, you've heard that we seek input from our epi data, but also recognize community knowledge as a skill set to better improve our areas of focus for the school site selection. In addition, we continue to uplift the work of Raíces Collective, the CUDA Project, and the Coordinated Outreach Collaborative, the Pacific Islander Task Force, and others. This allows us to center cultural sensitivity at the forefront of our planning process. We're starting to shift towards an upstream approach, and it is important that we're in alignment with the experts who are doing this work every day. We're beginning to explore how is it that we can co-design together. The other thing that we're really focusing on in the grand scheme of things are our communication strategies and talking about which messages are more helpful to communities who have the least access to information. What is it important for us to talk about? Promotoras have been a critical and vital source for this. Through the county, and although our system is not perfect, we're beginning to create avenues for community to have a voice at the table. These efforts are in coordination with HPs, our vaccine planning team, SCO, and we've been able to strategically focus on areas of need through something called charlas or chats, a model that derived from community organizers in Central Valley. Finally, another one of our strategies is a neighborhood level type of approach. Many of our communities who are not often serviced by the traditional safety nets we seek in our county, we have to fully recognize that no community is a monolith and that the work continues as a county to reach our most impacted communities. What we have learned is that when we explicitly value the voices of community, we design different strategies that lead better outcomes for our Black, Indigenous people of color in this county. Now I'd like to introduce Javier Cabrera Rosales, Director of the CUDA Project, and then Stephanie Maineri with Latino Service Providers to give an overview of the efforts and partnerships that we have been working on at the community-based organization level.
Gracias, Denia. Thank you, Denia. Hello, everyone. I would really love to go into a lot of depth of a lot of this information, but with the time restrictions, I just want to give an overview, particularly around our vaccine efforts and support, which also ties into testing as well for us. Something that's commonly left out or that we don't always address is our emergency financial assistance and direct resources that we're offering as well. And then briefly, just some of the collective collaboration work that Scuda is doing, not only within our internal collaborative, but our support working alongside other collaboratives. So I'll start off with what is Scuda? So for some folks that may not know, Community Urgent Response and Aid, our focus is really around providing access to not only resources, education, and awareness as it relates to, in this moment, COVID-19, vaccines and testing for our low-income Latinx and Indigenous language-speaking community members. And so we do that in various different ways. We have an outreach and community engagement arm. We have a direct services component in partnership with over 10 community-based organizations throughout Sonoma County. And so starting with vaccines, there's a big focus, and that's kind of held in our outreach and community engagement arm. We do focuses on providing pop-up clinics, and so working to be able to provide a cultural response in a cultural relevant way for people to come together, access and get the education around the vaccines and potentially testing, but also come together in a way that's culturally appropriate, which usually includes food and dancing, and also access to either different artistic components that folks can express, and inviting the whole family, and providing charlas, if you will, which are chats, as Denia had mentioned. We are also supporting and doing charlas since the start of Scuda, and really focusing right now on the schools. And that could be before, during, or after vaccine clinics have arrived at those school campuses. Our focus has been a lot on our Spanish-speaking community members. So a lot of our services are provided directly in Spanish. And so our efforts have been there in supporting the schools' vaccine clinics. We do direct outreach in community in different ways. That could be showing up at other different clinics throughout the county, supporting other events that may be happening with information, particularly about the resources that we offer, and supporting in having these one-on-one or group conversations about vaccines. We all know that, within our communities and our culture, there are challenges in accessing or thinking about how to access vaccines, or even wanting to. And so we address that through having conversations, and not pressuring, but being able to create spaces for sharing facts and having deeper discussions about the challenges that folks are having in relations to getting the vaccine. We also have a weekly promotoras meetings that we do every Wednesday. It brings together different promotoras, promotores, which is healthcare providers or healthcare promoters across the county, to be able to have specifically conversations about new information or updates around vaccines or testing that then are commonly shared, and that we all have the same message and able to distribute that out to our communities. Testing is another component. Currently, last Monday, we started a very small pilot to provide rapid or antigen rapid testing for community members. And so folks that commonly may not get access or do not have the access point of funding to be able to pay for rapid testing in stores. We are offering that free of charge and walk-ins. And so that information I could also share in a flyer that we'll be getting in the next day or two. And around that, we also navigate people through our main phone lines to be able to get access to vaccines and testing. The last two parts I'll go through pretty quickly. Emergency financial assistance has some eligibility components on our website. It is intended to reach our most vulnerable community members, or rendered most vulnerable by the systems that are in place. And so making sure that we are setting that up. And so our website at Proyecto Cura could be accessed to actually see that eligibility requirements, our phone number, and we also provide, aside from emergency financial assistance, resource navigation for immediate needs and emergency needs, but also recovery needs for folks that may need that in connection with other community-based organizations. And then I'll pass it over to Stephanie, because I think it's important for the highlight, particularly of the COC, the Coordinated Outreach Collaborative, that we are also working in alignment with and alongside. So Stephanie, take it away.
Thank you, Javi, and thank you, Denia, for the invitation to be here. My name is Stephanie, and I'm the Director of Programs at Latino Service Providers. And I wanted to share with everyone on the call and those of you listening a few of the components that LSP has been really working through to be responsive to the needs of our community. So one activity or one of our branches or arms that we currently are holding at LSP is a team of community engagement folks who are actively going to schools, similar to a lot of other promotores and folks under Cura and other organizations, making sure that resources are available at school vaccine sites. So currently we have actually a team at Casa Grande High School who's right there right now, actively supporting that vaccine site today. And so across the county, we're making sure that we have a presence so that folks who might be hesitant or have questions or are needing resources beyond the vaccine are able to access them during these vaccine events. Not only are they going to school sites, we're also present at pop-up community vaccine events. For example, we've been to La Pulga de Sebastopol, or the Sebastopol Flea Market, on a pretty consistent basis, alongside Raices Collective and West County Health Centers, who are leading a lot of our pop-up vaccine sites across the county. And we're really making sure that folks are having access to resources and taking advantage of these events that are taking place in our community. Another branch of our organization with regard to vaccine or COVID response has been through our Youth Promotor Internship Program. So we have a group of 66 youth across Sonoma County who are learning about health disparities and are learning about inequities in our county as they relate to COVID vaccines and access to testing. And so they are being equipped with knowledge and information to be influencers in their families and in their peer groups and at school, and to really message COVID safety as much as possible in their respective groups. So that's again through our Youth Promotor Internship Program. And as Javi mentioned, LSP is also helping to lead alongside with Center for Wellbeing and La Plaza, the COC, or the Coordinated Outreach Collaborative. So this is a collaborative that has that really stemmed out of a lot of work that many community-based organizations took time to go through and identify issues, health equity issues, and possible solutions to our COVID response as a community. And so LSP is currently helping to lead a group of organizations that can work toward sustainability or work toward achieving sustainability for community health workers or promotoras in Sonoma County. So we know that a lot of promotoras and community health workers have been doing a lot of work to make sure that people have access to testing and vaccines and other resources. And they need our support too, because these are incredible folks in our community that have taken on an incredible burden of doing a lot of outreach and engagement work. And so we have set out to provide support and provide sustainability for these groups of folks in our community. And with that, I'll pass it back over to you, Denia. I understand there are some questions.
I will actually pass it over to Paul, and thank you both for your contributions to today's conversation.
Yes, thank you. Thank you all. I think it's important for everybody to know that so much of the work here has really been going on, or the groundwork for this started over 18 months ago. And so many of these efforts were started from scratch. And this is really, it's really because of your efforts and commitment that we have made such progress here in the community in terms of getting people vaccinated. So I really applaud you for all your tireless efforts. I know you're exhausted, and we appreciate you being with us today. So as Denny said, we're going to take some questions now from the community and our media partners. First, Denny, I'm going to start with a really basic one for you. One of our viewers on Facebook asked, what is equity? And by extension, what does it mean to have an equity lens in our vaccination effort?
That's a really good question, Paul, and it really allows us to center the conversation today. So I'm going to refer back to a definition that we have as a county, actually through the Office of Equity, and then I'll define what it means to do health equity work in that regard, right? So the Office of Equity, pointing in our peers here, it defines equity as an outcome, right? Where you can tell the differences in critical markers of health, well-being, wealth, race, ethnicity, and it's also described as a process in where we explicitly value the voices and contributions of people of color, low income, and other underrepresented and underserved communities. And then they help identify solutions to achieve that outcome. So it's a really, it's a process, it's an outcome, and it is a lot more than in one single-handed approach, right? And then health equity, we've defined it further into an outcome in where, so if equity is an outcome, then health equity is the outcome in where access to a living and healthy, thriving life, regardless of your socioeconomic status, ethnicity, gender, national origin, language spoken, and housing status, then that's how we define health equity. To apply an equity lens, in a lot of the work, it's broad, right? Like it's embedded into the programs, our systems, and also the designing of the systems as per our previous definition in partnership with the voices that we explicitly we have to explicitly value to then contribute to create those solutions together. So I hope that addresses the question. Broad, but there's
it's a huge issue, one that we could spend a lot more time on and have been. And the important thing is it really challenges us to new ways of thinking, new approaches. And I just, again, I applaud all of your efforts in really trying to reach all the members of our community in ways that are the biggest impact. Dr. Shendi, I'm going to direct this next question to you, and Dr. Mays, I don't know if you have some thoughts, but as our vaccine chief, Andrea from our viewers asks, why are we pushing the vaccine now for children before FDA approval? Why are we making a big deal about it now? What do you think?
Yeah, that's a good question. So as we know, it has not been approved yet, but we know from past experience that once the vaccine is released, then there's a lot that needs to happen to be able to make those clinics effective, for people to be able to come, and of course, for actual vaccine administration. There are many details involved. And so what we're hoping to do is to inform and educate the public as much as possible, and to get people's questions answered such that when that vaccine is available, then we're ready to go. In addition, we know that with the holidays coming up, with Thanksgiving and Christmas, there's going to be plenty more opportunity for people to socialize. And this year, it's going to feel a little better to do so. But at the same time, we would love to try and protect as much of the population as possible. We know that children are vectors of all diseases, and particularly with COVID, they can be very minimally symptomatic or without any symptoms at all, and yet can pass it on to more vulnerable older people in the family. So we really would like to try and minimize that morbidity and mortality and try to keep the community as safe as possible. So there are many, many different reasons, but the big reason is to make sure that everybody is aware and to try and get questions answered so people are comfortable as the vaccine arrives, hopefully in the first week of November.
Great, thank you. Dr. Mace, I think I'm going to give you this next one. Kamala, on one of our viewers, asks about the monoclonal antibody treatments. And I know there's a lot of discussion going on in the community about that. And she's asking whether we have any of the treatments in our county and why that's not being made more of a emphasis. Do you have some thoughts on that?
Yeah, thanks so much for that question. Monoclonal antibody treatment definitely has a place for treatment of COVID. We are working with our healthcare partners to ensure that we distribute the monoclonal antibody that we get through the state appropriately. It's got a fairly defined and limited use. And so it's not, for anybody who gets COVID. Most people are not going to require treatment with monoclonal antibodies. And if you're super sick, that may not be the right treatment for you. So with our healthcare partners, we're defining what that small group of people is that would qualify for monoclonal antibody treatment. And we are using that here in Sonoma County and are totally, I have a system in place for distribution of the treatment. I don't know, Dr. Shende, if you want to add anything to that?
No, I think that covers it. It's for a very specific group of people. And and as you said,
A group that has already tested positive, right? I mean, it's not a preventative treatment. It's
No, there are criteria for who gets treated, who would benefit from that treatment. And it's people who are already infected and diagnosed with COVID, not preventative in any way.
And if you're afraid of having something injected in your body, monoclonal antibodies injects a lot in your body. So I'll just throw that out. Okay, let's take a couple of questions from our media partners. Let's go to Phil Barber first. Phil?
Hello, everybody. Thank you. I had a couple questions. Dr. Shende, you are our vaccine chief in Sonoma County, but you're also a pediatrician. What are you hearing from families who have 5 to 11-year-olds about eagerness to get the vaccine and why? And I'm wondering, especially if you have patients who have underlying conditions that make them especially vulnerable, and what those parents are feeling about vaccination.
Hi, Phil. Thanks for the question. Overall, I'm hearing a lot of interest, a lot of questions about the vaccine. People are very excited because they've seen what COVID has done to their family members. And many of them just are waiting for the vaccine to be here, particularly again, as the holidays come upon us. Those who have chronic medical conditions are particularly concerned because they have been working hard to try and protect their children all this time. And it's exhausting, it's tough. And it really makes parents very anxious. So for the most part, I've been hearing a lot of positivity. That being said, of course, there are questions. Parents are going to be concerned about vaccinating their children. And again, I would like to emphasize that this vaccine, the dose is less than it is for adults. It has been shown to be quite effective in the study data so far in terms of antibody levels. The side effects seem to be less than what we see in older people. All of this is very reassuring. And I think it's really important to keep in mind too, that we've now had this vaccine for 10 months, and we have seen how safe and effective it has been. And the same should apply to children. So I would strongly encourage parents to vaccinate. And if they do have questions, to please follow up with their healthcare providers to get those questions answered. And as Paul mentioned, we will be having a number of educational sessions going forward in October, November, and December. But speaking to your primary care doctor or healthcare provider is strongly advised because that's a trusted location and a trusted person. But we strongly encourage people to protect their children and thus protect their families.
Thank you. And if I could ask one question for Kate, if she's still there. Kate, you put up a slide about COVID cases in schools and how many had to do with on-campus transmission. And I believe you said that those numbers were cases verified for on-campus transmission. I don't want to put words in your mouth, but is it safe to say that the number of cases coming from campus is likely higher than that? Am I right in understanding that those are only confirmed on-campus transmissions?
Hi, yeah, so that is it's a conservative estimate in that those are the cases in which contact tracing was performed, a positive case was verified on campus, and then those contacts that we were following then became positive themselves. There are other instances where through interviews, people may say that they believe that they could have gotten it on campus, but we don't have a verified link of transmission. So that number is only reporting those cases in which we saw a contact become positive after having contact with a positive case on campus.
Great, thank you, Kate. And I don't suppose you or anyone else there has numbers on days of school missed because of those positive cases on campus?
I do not have access to that data.
Okay, thanks everyone.
Okay, thanks, Phil. Let's go to Katie. Katie, do you want to ask your question? Or she actually she posed this question, which I'll read out loud. Are you anticipating supply chain issues in the vaccine rollout for children? For example, are there enough short needles and other supplies for children's vaccines? Dr. Shende, what are you hearing on that?
Yeah, that's a good question. What we understood from the talk from CDPH on Monday is that, and what we've heard in the national news, is that the supply of the vaccine seems to be plentiful. It may roll out a little bit slowly, but the vaccine supply seems to be good. And the supplies should be, in terms of needles and other equipment, should be sent along with the vaccine, just as it was earlier on. So we don't anticipate that there should be any issues, but we'll have to see as the everything unfolds. But that had not been an issue before. The issue was really the vaccine supply, which hopefully this time around we are told is not going to be a problem.
Okay.
And I'd like to add that, I'm sorry, I just like to add that for the first 1 to 2 weeks, it may be a little bit slow. However, the supply is expected to pick up soon after that.
Excellent. Yeah, nothing like what happened earlier this year. Look, Katie had a follow-up question. When will mask mandates be relaxed and under what conditions? I think we've made clear that we're part of the Abajo group and what conditions are for the overall relaxing of mask mandates. But I'm wondering if she's asking about the mask or vax health order, which we hope to put out this week. Dr. Mace, do you have a thought on that?
Yeah, absolutely. Thanks for that question. So very similar to Marin's amendment to the indoor masking mandate that was released last week, we are proposing, or not proposing, we're going to put out an option, an amendment to our indoor mask mandate, allowing certain indoor facilities or operations to be able to not have indoor masking, but there's very specific criteria attached to that. Everybody who enters that facility must be confirmed as fully vaccinated. In other words, have had 2 doses of the Moderna or Pfizer, or 1 dose of J&J, and be 2 weeks out from the last dose of the vaccine. So verification has to happen. And if everybody who is in an indoor setting of a stable cohort, in other words, places like gyms or college courses where you have the same students there every day, those are the kinds of places that would qualify for this exemption. And if everyone is proven as fully vaccinated, then they can not have the indoor masking as a requirement. Now, of course, anybody who still feels comfortable wearing a mask can do so in that setting, but it's not a requirement. In addition, the host, the employer, or the organizer would also need to keep a list of all the attendees at that particular day, that particular, day in the gym, let's just say, for example, and keep that available for 30 days. And if there were a case, then public health would be able to easily perform contact tracing. So those are kind of the requirements, and it's an opt-in system. So any particular organization or business that feels that they would meet those specifications can choose to do so. The alternative being status quo. In other words, continue with the indoor masking mandate and allow anybody, either vaccinated or not vaccinated, in. I think one of the other stipulations is that the going in and out needs to be really controlled. In other words, how you enter that building or that situation. So this would not apply, for example, to any spaces where there's a lobby or a hallway where people come and go. I don't know, Paul, if there's anything else you want to add to sort of
No,
make
I
that
think
clearer.
you covered it. And I think, as you've mentioned, we're hoping to get that out this week. Is it fair to say?
Yeah, I think we're getting it out.
similar to what Miranda said.
Remember, it's not an order, it's an amendment that
Yeah.
allows different businesses to opt in, and they can do that on their own time.
Yeah, it's an option. It's important to note that. Yeah. Okay, I'm going to go to Camille Escovedo from the SoCo News, who has a question about equity organization. Camille?
Hi. My question is, as leaders in these organizations and equity efforts, what are the next questions that you have about how to keep up and increase healthcare access for poor communities and communities of color? I was thinking about such as access to information and health services being an issue before COVID. I was curious what actions or you're finding through your experiences are, what your experiences are telling you needs to happen in order for that access to stay open beyond this.
Thank you, Camille, for that question. I'll pass it over to Javi and Stephanie to filter out here from that, give that perspective as community-based organizations. But I think here in health and like what we see throughout the pandemic and in public health is that the importance to look at health equity from an upstream approach, right? Where we have center policy in the middle of it as a governmental entity, and then how it might move into community capacity building and how all of that is interconnected to the social determinants of health and how things that have really impacted our families now are associated with mortality rates as well as communicable disease, risk behaviors, right? And mental health. So all of that to say is that when we begin to shift from an upstream approach as a health organization, we're looking deeper at the gaps and disparities from there. And we have to take in consideration some of the lessons learned. And what are the safety nets that we have created that are helpful to families to access information, resources, outreach, and engagement? We know meaningful community engagement is absolutely needed to healthier outcomes. That is, I think, the key most important one of the most important pieces. Also, the recognition that expertise really lies with community members, our promotoras, our the folks who are people of color, right? And that have the lived experiences. When we recognize that as a piece of expertise, we begin to explore what other strategies can then help our efforts as a health organization to really address all the other things that we see in the health field. I'll pass it over to Javi and Stephanie because I know they might have some insights into their own perspectives as CBO leaders. But
Stephanie, please. I'll go after you.
Sure, thank you. That is a really great question, and I appreciate the emphasis on, there were health inequities before the pandemic, and what we're seeing now is just an exacerbation of a lot of different issues that our communities face. I think something that we've learned as a community-based organization being involved in this work is how important trusted messengers and folks who have boots on the ground are in our communities. In the Latinx community, we know that information spreads really through word of mouth, and trust is a really important factor in making sure that people feel like the information they're receiving is truthful. And so we have really set out, which is part of our mission with the COC, the Coordinated Outreach Collaborative, to find ways to support promotoras and community health workers so that their work is sustained beyond the pandemic, and so that they're ready to respond to whatever health or social issue our communities are facing. So we're really trying to find ways to think way ahead, think into the future, and find ways to take what we've learned throughout the pandemic, the ways in which we're doing outreach and engagement and talking to people, and making sure that that's an integrated part of how we do things in our organization.
I'll just add that and thank you for this question, because I think it's really important. I really want to emphasize the part of what Stephanie and Denia had shared around trust. There's a big dynamic around dignity and humanity in this work. And we're really seeing that right before the pandemic, during the pandemic, and after the pandemic, there is still huge amounts of need in being able to find mechanisms or systems that we create as communities that are sustainable and allow us to be nimble and changing when need to be, right? Some of the systems that we work in and around are not as nimble and have some pretty strong boundaries in which and how we can work. And when we look at the makeup of our communities, that doesn't necessarily function very well, particularly when we talk about families and specific needs and how that impacts particularly the different neighborhoods, depending on how many resources or access points that they do have. And one part that I think is really important for us through Cuda's work and the collaborative is specifically around having a place for people to call and get some immediate assistance and support. That needs to be really sustained, because far too often in many places, not only in this county, but sometimes projects or programs are started up that really come to address an immediate issue. And then the necessity for how do we balance between emergencies that will continue to happen and also sustainability around recovery and resiliency as communities, right? And so those two things need to kind of coexist, because when we're practicing preventative and work towards preventative support and organizing and planning and all of that in preparation, when an emergency does come, we have the steps that we've taken to continue to nurture our relationships and grow our partnerships. A big thing that we've learned is that not everybody is still at the table, and we have a lot of work to do to continue to bring and encompass our communities that are most marginalized by the systems that we do have in place. So thank you for that question.
Okay, thank you, Camille. Let's go to Martin Espinoza. Martin?
Hi there. I thought I wasn't going to make the clock.
You made it.
Dr. Mace, Dr. Shende, we have been surveying local law enforcement and police agencies to get their vaccination rates. We have gotten quite a bit of information. We're working on a story about what those rates are. They vary, I wouldn't say widely, but they vary from the low 70s to the high 90s. I think Sebastopol Fire Department has 100% of its staff vaccinated, 97% of its police staff vaccinated. Sheriff's office here in the county, 73%. Given the importance of vaccine in reducing hospitalizations, reducing deaths, I just read on the the memorial page for law enforcement officers that COVID-19 is the #1 killer of law enforcement officers in the country. Can you guys speak to the importance of trying to get those vaccination rates among some of the agencies that have lower rates, of trying to get those up?
Yeah, Martin, thanks for the question. I think it is really important to get our first responders vaccine rates up, and that's what we're doing. So I believe it's a vaccine verification order. You know, Sonoma County is one of the very few counties in the state to have added first responders to the vaccine verification state order with our own local order. And it was done in a collaborative process because I think the leaders in that community really do understand the need for vaccination. So we are going to be able to present here some data on how many extra percentage of vaccination. You already have some data, it sounds like, from individual units or organizations, but we are going to be able to provide some aggregate data. We're doing a survey to determine what the impact of that vaccine verification order was.
Right.
It's really impactful. But I agree with you, it's very important for this
If I
group to
could-
be vaccinated. Yeah.
Dr. Mace, if I could interrupt, I would imagine that some of the progress that's been made is among those that have their vaccination rates now up in the 90s. But for example, the sheriff's office, Roner Park, and even the Santa Rosa Police, those numbers haven't moved because we've been asking, week to week. And I know that mandate or that vaccination verification order is what you would call a soft mandate. How about making it a hard one where testing is not an option, like for healthcare workers?
Well, we want to gauge what the impact is first of the soft mandate, the vaccine verification order. And it is really nice to see that, those who are unvaccinated in that group are actually weekly testing. So we want to see what the impact is, and that's the survey that's underway now. And then we'll revisit the situation. But I agree it's a very important group to get vaccinated. I don't know, Dr. Shende, if you wanted to add anything at all.
The only thing I'd add is that from the beginning of this vaccine program, patience has been what has been extremely important. And it takes some people time to become comfortable with the vaccine. And our hope is that people will understand how important it is. And again, particularly as we head into the winter season, when we always see more disease. There's always flu, and we know COVID is going to surge again. And so we hope that people understand how important it is, particularly because they have seen their colleagues so affected by COVID. But as Dr. May said, we will continue to evaluate our efforts and try to help in that effort as much as we can.
To be fair, I mean, I think I read something out of Solano County saying that law enforcement agencies there have vaccination rates in the 20s. But I don't think any of our law enforcement agencies have anything as low as that.
No, I've been really impressed actually with how high the vaccination rates have been comparatively. So, and we're, here in California, actually, we're far ahead too. And I'm sure, Martin, you're reading the national news as well, where this has become an issue. So I do think, we're working very closely. The collaborative approach is the best one. And we talk every week or every other week with our fire law EMS partners. And again, it's a really close collaborative approach that's been pretty successful.
Okay, thank you.
All right, we've gone on a little over our time today, but great conversation. Thank you all for taking part. We are going to end it here, but we invite you all to join us again next Wednesday at 4 o'clock. And again, a reminder that much of this information will be repeated tomorrow during our Spanish language rebroadcast of this panel. Please tell your friends and share this information when you can. And otherwise, we will see you again next Wednesday at 4 o'clock. Until then, be safe and drive carefully. Thank you, everybody.